What sort of healthcare reform would you support, and would it include a public option?
Let's start with Jane Norton.
It would not include a public option, I can assure you. We know that we need to engage in significant ways on healthcare reform. The status quo is just not working. There are wonderful, better solutions than we're seeing in the Pelosi bill. Things that offer choice and competition, that allow for pooling to spread risk, important things we can do. So there are a variety of things that we can do that would cause choice and competition to bring costs down. The two most important things we need to do in healthcare reform is to make sure that we're making health insurance more affordable and increasing accessibility. The Pelosi bill does not make things more affordable, and on the accessibility point, they bring 15 million new people into the Medicaid program, and we are finding more and more people on entitlement programs. That's wrong. We need to have a robust, competitive private market.
Steve, your view, please.
Yes, I would not support a public option at all, as probably most of us. To make this program more competitive, we've got to particularly stay away from any type of socialist program. I lived in 2 socialist countries, and I can tell you it's not good. And healthcare is even worse. So I recognize what they're trying to do, and yet we have no solutions that are being accepted. The Republicans are putting them up, but they're not being looked at. Cross borders, the tort reform, the competitive issues, the dropping of the commerce laws to allow better cross-border operations. I think we get the private industry together, and now that they've had a little bit of a shake, we get them together and let them solve this problem. You know, we've got some smart people running hospitals and doctors and insurance companies, and I believe that with this little bit of frightening event we're seeing right now, I know as a CEO I would certainly look at it differently right now. And I think we can go and solve these problems ourselves, but the government would just stay out of our way.
Healthcare policy, the right way, the wrong way to go about it. Ken Buck.
Well, I don't agree with a public option. I don't agree with federal funding for abortions. I don't agree with federal funding for illegal immigrants. I do think that we need to make sure that we increase competition by having portability of insurance plans. I agree with Jane that we need to deal with the lawsuit abuse or tort reform issue, there are many things that we can do to increase competitiveness. Having a government takeover is not one of them. I want to mention one important thing though, because I think it is a personal issue to folks in this room. Senator Armstrong in 1981 introduced legislation to stop tax creep, which is as incomes increase as a result of inflation, people go into the higher brackets. That was a bipartisan effort in the United States Senate and the United States Congress. Speaker Pelosi intentionally put a reversal of that in the health care bill, hidden in the 2,000 pages. It's that type of lack of transparency and dishonesty that we have to make sure does not occur in our health care bill or any other bill.
I'll finish this up.
Thank you. Well, first of all, I think it's becoming totally clear to everybody in this room and most Americans that this current debate in Washington really isn't about your health care, it's about your money. It's about ways for Washington to get more of your money. If you really look at the government efforts in health care, I think before we start having a government takeover of health care along the lines that they're talking about now, before we think about a public option, which we should not have, I would like the government just to show us one thing that they've done, that they've produced and delivered on time, on budget. they can't do it. It's just another example of the completely backwards thinking that we have in Washington right now. The systems that they're currently running are going to be bankrupt in 2017. So there are things that we can do. In the state legislature, I worked on legislation, helped pass legislation to help small businesses have the ability to band together to buy insurance. We've got a situation with health insurance. Insurance is based on the law of large numbers by spreading risk throughout the nation, and we've got a system that breaks it down state by state, and we need to be able to do that so we can spread these risks throughout the entire nation. And there are solutions to this, but it doesn't require sending more money to Washington, and that's what the problem is, because that's all Washington wants from all of us.